So we discussed some of the drugs now. Theophylline you said you have to dialyze if it is a overdose. So what are the dialysable poisons, Can all the drugs
So
be dialyzed?
all the drugs that is excreted through kidney can be dialyzed.
Like what?
Uh, Common drugs like metformin, or paracetamol, salicylate, um, um, just now theophylline, uh,
Paracetamol poisoning, how do you treat?
sales systems.
Ah, this is a mnemonic for your teeth.
Okay.
These are the drugs which are there.
Um, B is bleomycins.
Barbiturate, lithium, alcohol,
Theophylline.
sodium, and so easy to remember dialysable
Yes.
poisons. These are common drugs. What is this?
So, allopurinol is uric drugs, given in gout.
Okay. When we
Yes, it
use
is
in
used in
gout,
gout, sir. Uh,
when
when there is no flare, sir. To prevent further flares, sir. To prevent further
okay,
episodes. Yes, sir. Prophylaxis.
prophylaxis,
Xanthine oxidase
mechanism of action.
inhibitors.
Okay, what side effects you
Allopurinol.
expect?
mm, Not sure, sir.
Okay. Interactions any?
Yes, yes, sir. Actually,
Do you take any precaution when you give to other? How long you will give the drug?
lifelong, sir. In a patient who is diagnosed gout,
Lifelong. Okay. And what does it do? A target level.
less than 7, sir,
How
for
do you release
males.
the drug?
Okay,
In
sir.
less than 6 is the usual cutoff. Okay. So this Xanthine oxidase inhibitor, you have correctly said. Indications are, you said the non-acute
Okay.
cases. Do you give all cases which is not acute, or you do have
Okay.
selection criteria? Recurrent gout. Recurrent means more than 2
Okay, sir.
attacks per year. Those who are having top 5. Confirmed case of uric acid stones, renal diseases, and sometimes when you give drugs for chemotherapy, suddenly it may go up, or when you give thiazide like diuretics, you may try to give allopurinol. What is Lish-Nihan syndrome?
Uh, it's a destructive disease wherein the patient, um,
Mentally challenged,
yeah, yes, mental challenge.
polyacidosis, self-mutilation, no?
Yes, sir. Mutilation.
And hyperuricemia, the genetically transmitted disease.
Yes.
So here again you have to give.
Okay, sir.
And tumor lysis syndrome, how do you recognize it?
Sir, there will be hyperphosphatemia, hyperkalemia, hypocalcemia, hyperuricemia.
Calcium goes up or goes down?
Goes down, sir.
Okay. So you rightly said acute gout you should not give. Commonly given when the inflammation settles down.
Yes.
It may take at least 2 weeks time. Usually you start with 100 milligram and slowly you titrate up. There are a couple of very important interactions with this drug. Azathioprine is commonly given for patients who have undergone transplantation or some other indication.
Yes.
Azathioprine is commonly metabolized to 6-MP mercaptopurine and then to 6-thiouric acid with the help of xanthine oxidase. So
Okay, sir.
when you inhibit the xanthine oxidase, azathioprine is not metabolized and produces side effects.
Okay, sir.
What is toxicity? When you give cyclophosphamide again, renal clearance decreases. So when cyclophosphamide level remains high, it produces bone marrow depression. So transplant patients basically, chemotherapy patients, we have to be careful when you give this drug. And what are the common side effects?
Side effects of
Allopurinol. It's a drug which can
yeah.
produce very fatal reaction. Allopurinol can produce very fatal reaction.
Okay, sir.
It can produce vasculitis. So
Okay.
some people are more likely to suffer with the side effects of this drug, and that can be recognized with the help of HLA recognition. And
Okay.
some countries very very high level of this allopurinol side effects commonly check this HLA and then only proceed with the treatment. So it can be very bad side effect with allopurinol.
Okay, sir.
Can you make out anything?
It's a chest X-ray behavior showing bilateral prominent hilar markings and the cardiac border showing boot-shaped appearance.
It is actually small size, no, small size, long
Yeah.
heart, and the diaphragm is flat.
Yeah.
So possibly hyperinflated chest.
Okay.
This part of the lower zone, both sides is relatively clear. The upper zone is also relatively clear. Middle zone shows what?
Bronchoscopy markings.
Where prominent markings are seen in mid zone. So mid
Yes.
zone opacities of this type, which are the diseases where you get mid zone disease basically. One is pulmonary edema,
Pulmonary edema is the first thing, sir.
PCP pneumonia,
Pneumocystis.
pneumocystis,
Yeah.
pneumonia,
Okay,
and
sir.
all viral pneumonias you can have this type of patterns.
Okay, sir.